Hello friends, today we are pleased to have with us at Homeopathy Hot Seat Dr. Luis Guzman Carreto from Mexico. Dr. Jose is a practicing radiologist. He is also practicing in geriatrics. He is a qualified homeopath and he is also a qualified acupuncturist. Dr. Jose, welcome to homeopathy.com.
Thank you very much. I'm very glad to stay with you here in India. It's your beautiful country. I'm very glad to stay with you.
Thank you so much. Dr. Jose, you are qualified as an MD, as a radiologist. Then you also qualified in geriatrics, that is the treatment and study of old people. And then you went on to study homeopathy, then you went on to study acupuncture. Tell me, how did you find homeopathy? How did you come to homeopathy? From being a conventional medical doctor, what led you to homeopathy?
Well, when I was trying patient, I some trouble to find the very good treatment. It's for that reason that I'm looking for the best choice for my patient, and the homeopathy is for me is a very good choice.
Okay. But was there any episode which led you to homeopathy? Were you aware of homeopathy before?
Before I was very sick some years before, and I couldn't find any treatment for me. And for that reason, I'm looking for a homeopathy treatment in my country. I find it and I cure it by myself. For that reason, I think that this is the best way for my patients. It's very interesting and very good treatment.
That's amazing. It's just like so many other stalwarts in homeopathy who converted to homeopathy after seeing the results for themselves.
That's correct. That's correct.
So you have a very special interest in treatment of old people. You are qualified as geriatrics. What from being qualified as a radiologist, what made you interested in the treatment of old people in geriatrics?
Well, I think that geriatrics is a very new medical specialty, not only in my country, it's only in the world. And this is a very good opportunity that we have to make these elderly patients to this kind of treatment, because elderly patients has some trouble of disease.
So for the students who are listening to you today and the homeopaths who are not aware of the scope of geriatrics, can you tell us what is geriatrics and geriatrology?
Well, really, geriatrics that means the treatment of the disease of the elderly people, and gerontology is the study of the different aspects, like a psychosocial and psychologist aspect of the elderly people. That's it.
Today we know that in large parts of the world, the population is aging.
Yeah.
Only few countries like India which have got a predominantly young population, but in most of the Western world the population is aging. The number of elderly people is increasing because the life expectancy has gone up. As a doctor, what is the actual situation of elderly people around the world? How do you see it?
Well, I think that how the people is more expectancy of their life. Most people in the world has now is elderly, because I think that in too much countries it is very necessary to have a change to the public health system to give this kind of patient a very good treatment.
Okay. And as a homeopath, do you treat these elderly people with homeopathy?
Yeah, I have been treating my elderly patient in my medical office with homeopathy with very good results.
What are the common problems that elderly people come to you and which respond very well to homeopathy?
Well, one patient, an elderly patient, it hasn't only one disease. It's a mixture of disease. And you see, the elderly patient has different, like pluripathology. And this kind of patient is taking too much conventional drugs and they give in the conventional medicine. And the most probably is for example, the complication of the diabetes, hypertension, osteoarthritis, too much different kind of disease.
Yes, that's very same here in India also. Most of the patients, elderly patients whom we treat, they come with a large box of medicines, with medicines for diabetes, hypertension, cholesterol, often for hypothyroidism, and so many other small multivitamins and so many other whole box of medicine which they are taking throughout the day. And it's actually so sad to see that these people are not improving in their health despite taking so many medicines.
Yeah, that's right. And you see, when I see the elderly patient, it's probably that you don't have the clear image to the patient, because this patient is like is taking too much medicine. The patient has a side effect or other effect of toxic effect of this drug, and you don't see very clearly the image to the patient, and this is necessary to taking off this kind of conventional remedy, but gradually, not suddenly.
So how do you treat these people who are on so many drugs and where the image of the remedy is not very clear? The disease picture is mixed with the drug picture. How do you treat these people?
Well, on the first time, I'm going to take it off these conventional drugs, but very gradually, slowly. You know, if you are going to remove all the drugs, suddenly maybe you can have any trouble with the disease. And after that, I'm going to have the clear image to the elderly patient for trying to find the exactly remedy on homeopathy that I'm going to give these kind of patients.
Often these old people have far advanced pathology, like patients who have osteoarthritis, and there's a lot of change in the joints and it is not totally reversible. Or the patients who are on allopathic drugs since last 10-15 years, how well do these people respond to homeopathic treatment?
Well, I see that the response to the homeopathic treatment is very good in the beginning, and I see in my office we trying to do more aspect to the more qualified of life this kind of patient, because the damage is chronic and sometimes irreversible.
So, what are the common problems, what are the common syndromes that you see in elderly people in your practice?
Well, I see like we aggregate this kind of elderly patients not only one with the name of the disease that call the conventional medicine call it. We call in this kind of disease like syndromes. The syndromes is the name that we are aggregate this patient that has different troubles.
So, when you treat these people with syndromes of various ailments, do you treat them separately or do you treat them as a whole together? Like if a patient is coming with diabetes, hypertension and osteoarthritis, will these be treated together holistically, or you will be giving different remedies at different time for each of the complaints?
Well, each case is different. You know, we need to see which is the principal complaint of the patient that we came with us with the first time, and after that we are going to try to make a holistic treatment to the patient with the homeopathic point of view that could be better for these patients.
And what about the problems on the neurological plane or psychological plane, like Alzheimer's and Parkinson's disease and memory loss? That is very common in elderly people. How do you deal with them? Do you use homeopathy for that, or do you use conventional medicine for that?
No, I think with this kind of problem, the homeopathy has a very good results in this kind of patient. You know, as you tell me now, we have some remedies like varita carbonica, elevorus, opium. You know, this is kind of remedies that it will help this patient very good.
and that's true. And how do you deal, because these patients are taking so many allopathic drugs, and we know that all conventional medicines have a lot of side effects. They have a lot of toxicity. They damage liver, they damage intestine, they damage kidneys. How do you deal with the side effects of the conventional medicine?
Well, as you know, if you are taking, when patient is taking too much several drugs, the elderly patient has not, the liver is working on 100%. For that reason, we need to remove these kind of medical drugs, as I tell you before, with very slowly, because the liver is not functioning at 100%. We need to take it to remove this drug gradually.
And is there any role of diet, natural medicine, mother tinctures in removing the toxicity of allopathic medicines or improving the vitality of the patient?
Yeah. We need to have a completely point of view about this patient. It's necessary that this patient has to diet, very good diet. The family care is very important to this kind of patients. All this element is going to help to the treatment. But homeopathy is, I think so, is a very good choice for these patients.
Another aspect that I often see in the Western world is that the elderly people are often sent to nursing homes or old age homes. They are not living with the family. My perception is that elderly people need as much care as a baby does.
Yeah, exactly. That's very right.
So, what is the right environment for caring for the elderly people? Should they be treated at home, or should they be admitted to nursing homes or old age homes for professional care?
Well, really, I think that it could be better that have the elderly people at home, because the family has a good properly take care with them.
That's so right. Here in India also we see that majority of time the children take care of the elderly, and we see less psychiatric ailments in the elderly because of that.
Yeah, that's right.
I feel that the love and affection that a family can give can never be compensated by nursing care.
That's right.
So, you have been practicing homeopathy since last 15 years, I believe?
Yeah, I was studying homeopathy in Mexico, in the School of Medicine in Mexico 20 years ago. And after that, I'm going to begin my private practice in my office. I have 15 years of practical experience and tried into the homeopathy.
So what has been your experience with homeopathy since last 15, 20 years?
Homeopathy brings to you like a change in your life and change on your mind. You need to open your mind to this. And I think that homeopathy is going to new life in your brain for try to this patient. It is a very good experience that I'm going to change this medicine for conventional medicine.
And what change did it bring to your personal life? Because you were trained in conventional medicine, you are trained in two different streams of conventional medicine, and then you come to homeopathic philosophy. What changes it brought to your thinking process, your thought process, your approach to patients? What was the change that occurred to you?
Yeah, the change that when I went to study to the philosophy, to the organon, for example, this is the first thought to the Samuel Kahneman, is bring with me to a new life and in my life, and is making a change on my thoughts and my thinking about several items of the life. I think if you study the philosophy, you can find too much answer to many questions that you have in your life.
That's true. The homeopathic philosophy is not just a revelation to treat the patient, it changes your perception of life also.
Okay.
So, at present, what is the situation of homeopathy in Mexico?
Well, in Mexico, like you see, is similar situation in Latin America. In Mexico, we have 2 or 3 schools with very good quality, And now I think that homeopathy in right now is growing to the country. It has a very high development on the teaching, on the application to the different kind of college. And I think that we need to have more effort to this kind of teaching the very good homeopathy. But I think all the homeopathy needs to be joined together for make the homeopathy the best choice.
So is homeopathy approved by the government?
Yeah, in Mexico, homeopathy, the license approved the homeopathy. It's like official therapy. It's the second therapy what we use in Mexico.
Okay, so it is the second most popular system of medicine
right.
used in homeopathy.
That's right.
But who can practice homeopathy in Mexico? Is it only MD doctors, or can a layperson also practice homeopathy?
Well, the laws in Mexico, the government laws is required to, the professional needs to be graduated in the medical school, and after that is going to take the postgrad during 2 or 3 years study also homeopathy. It's like to especially it's medical specialty.
So homeopathy is studied as a medical specialization in Mexico.
That's it.
Okay. And do you see a lot of public acceptance for homeopathy in Mexico?
Yeah, but it's necessary that the patient has a very good result, and then we have the evidence, good evidence. And is this the reason that the professional sceptics can convince it that is a very good result to the homeopathy? I need to see that this kind of people that in that moment don't believe in the homeopathy successful is give him evidence, too much evidence that can prove to these people the efficacy of this therapy.
Okay, so is there a lot of government support for homeopathy in Mexico? Like, does the government promote research in homeopathy, or are there any government doctors practicing homeopathy?
Well, I think that the government has the budget, for the public health services, but the homeopathy doesn't have received enough effort to the government. The effort is only private association, different, but no, the government is not giving too much financial resource for this kind of investigation.
So the government is not funding any research or education, and only the private organizations are involved.
Yeah, that's
okay.
it.
I hope this situation changes and government gives more funding for homeopathy in Mexico, just like it does in India.
Yeah.
Because when we get government funding and support, then a lot of institutes and a lot of research work can happen. So you are also trained in acupuncture, another therapy which is related to energy.
Yeah.
What similarity or dissimilarity do you find in homeopathy and acupuncture?
This is a very good question. And when you are going studying in the medical college, you are studying pharmacology. Pharmacology means that biochemical point of view. On the other hand, with acupuncture and the homeopathy has biophysical aspect, which is only energy management. There are some point of view very common, and there is another point of view very different. When you are going to manage this patient, homeopathy is the one road, and the acupuncture is the other road. But the same thing is the managed with energy in both cases.
That's good. So you see results from both therapies in treating elderly people.
Yeah. It's very good results, and the cost is a little more cheaper in comparison with the conventional medicine.
Yes, cost effectiveness is one very important factor, because with so many drugs, the cost is often prohibitive. Treatment of conventional medicine is often very costly, and definitely homeopathy is a much cheaper and much more effective option for treating many diseases in elderly people. Dr. Jose, are there any homeopathic remedies that you often find indicated in elderly people?
How I don't understand. Is it the most
Common remedies that you find indicated in elderly people?
Well, it depends on each patient, but for example, varita carbonica, I think that could be a very good remedy for the patients. You know, well, it depends on the case, but we have another kind of remedy, phosphoric acid, selenium, you know, it depends on the patient need it.
Yes, it definitely depends upon the patient. And is there any other information regarding the treatment of elderly people, any guidelines that you would like to share with other homeopaths who are listening to you today?
Well, I think that it is very important that we, the homeopathists, needs to have more study, needs to have more information about the new treatment. I think so.
Okay. So nutrition is a very important aspect for treating elderly people. We need to make sure that they have a healthy diet also. And it has been wonderful talking to you, Dr. Jose. I really hope that in homeopathy we see more research regarding treatment of elderly people, and we are able to publish effectiveness studies. There are already some studies which do show that homeopathy is very effective in treating disorders of elderly people, but more research is needed, and I hope more qualified people like you come into this stream and motivate others to follow this path and provide a healthy life to the elderly people across the world. Dr. Jose, this is your first time that you are here in India, and it is a pleasure to have you with us here in my office in Jaipur. What has been your experience like coming to India and experiencing homeopathy here?
Well, I'm very surprised for your wonderful country. Your country is very nice and very beautiful country. I'm very happy with that with you. I came here with my family, my wife and my son, and it's for us a very pleasure for your attention, and you are a very kind person.
Thank you, Jose. Thank you so much.
Okay.